Hello everyone, welcome to the journey of Medicine Guruji. The first topic that I will cover today under Medicine Guruji section is hypertension part 1. We all know hypertension is a very important disease in clinical medicine. I am Dr. Awadh Kapoor, your mentor. What will we will be learning today? We will be seeing about the case definition of hypertension. We will be seeing the types of hypertension, classification of hypertension. We will be talking about secondary hypertension, the differential diagnosis, how to diagnose hypertension, the investigation part, and then the treatment part that will be divided under two sections. We will be covering part 1. How to define a case of hypertension. Hypertension is defined as any person having systolic BP greater than or equal to 140 millimeters of mercury and a diastolic BP greater than or equal to 90 millimeters of mercury. But we should always remember BP measurement must be an average of 2 or more readings on 2 or more visits, and it should be in a comfortable seated position. We should not start or we cannot take any decision based on a single reading. Now coming to types of hypertension. What are the various types of hypertension that we see? First is primary hypertension. When we do not know the cause, it is generally seen in 90 to 95% of patients. That is known as primary hypertension. Another is secondary hypertension. When there is a specific cause. There is also another term known as isolated systolic hypertension. When we record systolic BP more than 160 millimeters of mercury and diastolic BP less than 90 millimeters of mercury. It is very common in elderly subjects and it is due to reduced vascular compliance. So remember, we have three main types: primary, secondary and isolated systolic hypertension. How to classify hypertension? As you can see in the chart, the normal blood pressure is less than 120, less than 80, systolic and diastolic values. High normal range is 120 to 139, diastolic range is 80 to 89. The stage 1 we classify as the systolic range is 140 to 159, 90 to 99, and stage 2 is more than 160 millimeters of mercury and diastolic BP is more than 100 millimeters of mercury. Students, try to learn these values. These will be very useful in your day-to-day practice and in OPD. What hemodynamic pattern we see in hypertension? In young, the increased blood pressure, as we all know, cardiac output increases into total peripheral resistance. And in elderly, increased blood pressure, there is reduced cardiac output and much more increased total peripheral resistance. Coming to pathogenesis of hypertension. In majority of cases, around 90% of 5% of cases, no specific cause can be found. This is known as essential hypertension. In 40 to 60% of cases of hypertension, they can be explained by genetic factors. Age is a very strong risk factor and also high salt intake. The high salt intake is very important in today's life when we are eating too much of junk food, fast food. Alcohol, obesity, and lack of exercise are also predisposing. Impaired intrauterine growth and low birth weight babies, they are at increased risk in their future life. In 5% of cases, hypertension is due to secondary causes. What are the secondary causes that we will discuss in our coming lectures? Who are at risk? We should always remember this. In sex, men and postmenopausal females. Advancing age, geriatric age. There is a strong family history. People living sedentary lifestyle, lack of exercise, and various psychosocial stress present. People smoking, taking high cholesterol in diet, our youngsters, low fruit intake, we are losing a habit of eating fruits, obesity, having diabetes and hyperlipidemia. This is a very dangerous group, and high intake of alcohol. What are the various clinical features a hypertension patient has? Remember, it is known as silent killer. Hypertension is because mainly asymptomatic. How we diagnose? Diagnosis is made on routine physical examination or when there are complications. That is why it is recommended a weekly checkup is advised every 5 years in adults or over that are over 40 years of age. We also encounter in our OPDs morning occipital headache. People complain of dizziness, fatigue. There can be episodes of epistaxis or there can be episodes of blurred vision. The disease is attributable to hypertension. It may lead to MI, myocardial infarction, left ventricular hypertrophy, heart failure, coronary heart disease, encephalopathies, hypertensive encephalopathy. It may lead to stroke, cerebral hemorrhage, chronic kidney disease, very common with hypertension, uncontrolled hypertension, preeclampsia, eclampsia in gynecology, blindness, aortic aneurysm, and may lead to gangrene of lower extremities. What indicates secondary hypertension? You should remember this slide. Onset of high BP before 35 and after 55 years of age. Onset. The hypertension is resistant, accelerated, paroxysms of hypertension along with headache and palpitations. There is abnormal urine examination and abdominal bruit. Let's see the differential diagnosis of hypertension. Chronic kidney disease, that is secondary we are talking about. The features will be elevated creatinine, abnormal urine examination. Whenever we are seeing coarctation of aorta, there is decreased pressure in lower extremities or absent femoral arterial pulses. Cushing syndrome, very important, due to steroid abuse, glucocorticoid excess. There can be truncal obesity, glucose intolerance, striae, purple striae, pheochromocytoma. There is labile hypertension, headache, palpitations, renovascular hypertension, onset of high BP before 35 and after 55 years of age. The hypertension is resistant, accelerated hypertension, thyroid and parathyroid, goiter, hypercalcemia, and sleep apnea that leading to by obesity and snoring. What are the diagnostic criteria of hypertension? Remember, diagnosis is always and mainly clinical. We should again remember BP measurement must be an average of 2 or more readings on each of 2 or more visits. In seated position, detailed general and systemic examination should be carried out on the patient to rule out secondary hypertension. What investigations will be required for a case of hypertension? We can go for hemogram complete, urine examination complete, blood urea, serum creatinine values, blood sugar, lipid profile, fasting values, ECG and X-ray chest. We can also go through a other battery of tests according to our need. What treatment are advised? We will be discussing part 1. The very important is lifestyle modification and drug treatment. Lifestyle modification, lose your weight. Dietary approach, we should follow DASH diet. I will explain that to you in later slides. We should reduce dietary sodium to less than 100 millimoles per day, 2.4 grams of sodium. We should eat more fruits and vegetables in the diet, low in fat, dairy products, cholesterol, saturated and total fats. Regular physical activity, brisk walking is very important, 30 minutes most days of week. We should quit smoking. We should advise the patient about alcohol. Men not more than 30 ml per day of ethanol, women not more than 0.5 per day. We should avoid harmful habits like smoking, alcohol, reduce salt and high fat diets, lose weight, regular exercise, and we should follow a DASH diet plan. A word on DASH diet. DASH stands for dietary approach to stop hypertension. The DASH diet is a healthy eating plan designed to help treat or prevent high blood pressure. In a short way explaining the DASH diet, the DASH diet plan includes eating more fruits and vegetables, low fat and non-fat dairy products, beans and nuts, and eating less fatty meats, full fat dairy products, sugar sweetened beverages, sweets and salt, sodium. You can see a sample picture of DASH diet. There are lots of fruits, nuts. Now compiling our topic, coming to a case discussion. Look at this case. This is a first case. A 45-year-old woman. Her father had a history of myocardial infarction at age 60. She does not smoke. She works at a local bank and is often stressed with work and has 2 kids. She tries to exercise regularly by going for a walk with her family, but admits she does not always succeed. Irregular exercise. She and her husband each have 2 glasses of wine after dinner regularly. Upon physical examination, her blood pressure is 138/87. her weight is 72 and her BMI is 28 kg per meter square. ठीक है, नॉर्मल वैल्यूज are 18.5 to 24.9, obese. No edema or murmur is noted. She is overweight. She does not have an abdominal bruit. Her lab workup shows normal range. Her BP was 134 by 86 millimeter of mercury 1 year ago according to her chart. Now it is 138 by 87. In addition to increasing exercise and adhering to the DASH dietary approach to stop hypertension diet, what else do you recommend for your patient? A. To start antihypertensive drug daily. Limit alcohol consumption to 1 drink a day. Add resistance exercise to her routine. Think about this case. Then we will discuss this in our next video. Now coming to a second case scenario. Rani is 38-year-old. She is attending for a routine appointment about her contraception for family physician, for which she uses a diaphragm. Medical history from her records, you notice that Rani's blood pressure has increased since her last check 12 months ago. She does not smoke, drinks 10 to 12 units of alcohol a week, and has no notable medical history. On examination, Rani's first clinical blood pressure measurement is 158 by 94 millimeters of mercury. Heart rate is 72 beats per minute and it is regular. What is the next step for Rani's BP? Think about it, friends, and we will be discussing that in our next video. The detailed treatment part of hypertension and case 1 and 2 both. I have written here case 2. No, I will discuss both cases 1 and 2 in second video. In that is hypertension part 2. Ending our journey. Have a golden career ahead. Thank you. Thank you very much.